with the University of Dhaka. But University of Dhaka doesn't know much about the disability field in terms of knowing where people are, so we can ask them. So therefore we contacted the largest networking organization in Bangladesh. I think they have nearly 300 networking organizations that they network with. And the name of that organization is Center for Disability and Development. So we asked them for their assistance to try to find out users of assistive technology. So they contacted their partners and they selected 10 organizations which had the highest number of users in the respective working areas. So we collected data from these 139 hearing aid users, 150 wheelchair users, in 8 different districts. There are 64 districts in Bangladesh. And in 6 of these districts, we tried to find, they found out all people, all users of assistive technology available in their working areas in these 6 districts. So if there are 2 million people on average living in a district, and there are 20, 30 users of assistive hearing aids or wheelchairs, it's not easy to find these people. So this was the strategy that we used to find as many as possible.
Hi, Darren Zook from the Department of Political Science at University of California at Berkeley. First, I think it's great that you've done this kind of data collection, because I work so many places where it just doesn't exist. But the one thing that caught my eye was when you had the percentages of the participants in your sample is this kind of skewed gender. You had 63% in one and 74% were men. And I know from working in Bangladesh, there, especially in the NGO community, there's kind of an entrenched social conservatism, especially in villages, about directing things towards men. And I'm wondering if in the collection of your data or simply in doing this field work, if you either had to account for this kind of social conservatism, or whether you found that there was this idea that if benefits are available, they should be going towards men, or whether gender played a role at all in your data collection.
This is basically the reason why we adjusted for gender in the regression model, to take this into account. Yeah, it's a well-known fact that it's more difficult for women and girls in Bangladesh to get rehabilitation services. Not only rehabilitation services, also health services. But we have not seen if there is any, we call it inequality in the provision of assistive technology, because we don't know the needs, and the needs may differ between genders. Normally men are more often involved in traffic accidents and falls and things like that, while women maybe are more likely to have other types of impairments that can lead to disabilities. So the actual need we don't know. So we don't know whether this is represents an unequal situation or not. No.
Chris Coward, Technology and Social Change Group. I'm wondering if you shared these findings back with those NGOs, those organizations that were in that network, and whether they changed their practice, or how did they react to it? Because you said that most of the wheelchairs that they gave out through these ceremonies did not involve the users. Have they changed their practice, or what was their reaction to the findings that you did share the findings?
We will share the findings. This is the first time findings from this research project are presented. And we have a couple of manuscripts underway. One relates to the human rights aspect, whether there's a relation between assistive technology use and human rights enjoyment. And for hearing aid users, we have 12 indicators of enjoyment of human rights. Using hearing aids is significantly related to 11 of them, while wheelchair use is related only to one, but a very important one, mobility.
My name is Paige Stringer. Paige Stringer. And my question is, you were talking about in your results that it may be time for alternative strategies for developing hearing aids. And so, was there any and hearing services, I guess? So, was there anything that came out of that, or some specific examples of what might be an appropriate alternative strategy?
Thank you for asking that. I didn't want to take time in the presentation to elaborate on that, to try and run out of time. But I learned from being involved in the guidelines of the wheelchair guidelines of the World Health Organization that using non-professionals is the possible way forward. We met a lot of, there were physiotherapists and occupational therapists involved in developing the guidelines, and they wanted to see very advanced assessments being done, even for very basic needs. So the WHO representative, he kept saying that basic is basic, basic, basic. Just to keep it as basic as possible, requiring a minimum of skills. So people, the basic course that is being developed now is just a 2-week course, and basically to be able to identify whether a person can sit upright by himself or herself, and then if they can do that, they are able to provide a wheelchair. If not, they should be referred to the next level. And I wonder if it's not possible to do something similar to reach the millions of people who need a hearing aid, who would benefit from one. By training CBR workers, for example, in checking the ear, what the reason can be for if there is a foreign object in the ear, or if there's wax that can reduce the hearing. If not, maybe to try a hearing aid. If it works, it's fine. If it doesn't work, refer to the next level.
Questions? Maybe one more?
Thank you. We could probably talk for hours. Are we going to have these slides available?
Yeah.
Okay, very good. Thank you. My question was about your strategy for finding out this retrospective questioning of these users' historical recall. Is it possible that people may not remember whether they were asked any questions at all? Is there a certain kind of assumption that we have about this being such a significant event, the moment of fitting a wheelchair or being fitted with a device? I'm just curious. I was remembering maybe when I learned how to drive a car, did somebody ask me, do you know how to use the brake or something like that? So, what's the sort of logic there to assume that that's going to be actually a useful way to find this out?
I have thought about this as well, and I'm not going to good answer whether you remember or not. I know that the average time they have used assistive device is about 5 years, and it will be difficult to remember what happened 5 years ago when they were assessed. That's true. So that can affect the outcome. That's true. Thank you very much.
Just very quickly, I think to try and answer maybe his question about whether it's a significant thing for somebody to be asked these questions, I think at least some of the literature definitely shows that even in developed countries, a lot of times when somebody's being fitted with more like medical sort of devices, it is the doctor's opinion, it's the expert's opinion that counts. You assume what they need. You're not really asking them, so where do you plan on using it, how many hours a day you might require it, what's the environment you're in. And I'm just throwing some questions out there, but those questions might actually never be asked. But I think your point about maybe they might not remember it is a good one, but I do think it's a significant thing to study and to find out.